Hi, this is Ryan from SurgMate. Today we are happy and honored to have Dr. Stefano Spiezia and Dr. Giovanni Mauri, both experts from Italy, to share their experience in thyroid treatments with us. From the doctor's perspective, Dr. Spiezia, what's the difference you think between choosing ablation procedures and traditional surgeries? And what are the benefits for doctors and patients in doing so?
I'm an endocrine surgeon, and my first activity obviously is to do surgeries, but it's almost 20 years ago that I started to work on thermal ablation procedure. I think that we have a very good chance to offer the patients a new modality for treatments that are not invasive, minimally invasive, with a very high rate of efficacy, no long-term care, no long stay in hospital, no need for long life replacement therapy, because we don't remove the gland. Thyroid gland is very important for all the metabolic pattern of the body, for a very important network between brain and such other organs like heart, muscle, bones, and so on. So when we remove gland and we replace therapy, it's not all. We need something more that we still don't know very well. So if we cannot do this and save the thyroid, save your thyroid is our slogan, our philosophy, we save an important gland. Considering that patients actually suffer from benign goiters, benign nodules, they don't need to fully remove the gland. But we can remove the problem, the issue. What's the issue? The statical discomfort, for example, or the compression. So I think that we need to understand that if we can offer the patient a very good option to reduce the symptom, to completely let the aesthetic discomfort disappear, we do a very good option for all patients that need to be treated by this technique.
And Dr. Mauri, so how did you start your journey on minimally invasive treatments of the thyroid, and what's your story?
Yeah, I started during my residency. I was working in Busto Arsizio with Professor Sorgati, one of the former pioneer in thermal ablation in the liver. And at that point he decided to apply also to thyroid, and I was working there, and since the beginning I collaborated with him, and then I started my own journey more focusing on thyroid, and I fall in love with thyroid, which is a very satisfying procedure also for physicians, because patients can really see very soon the result of what we are doing. It's different from treating, for example, a liver, where a patient might not realize what's happening. In the thyroid, they can really see what we are doing, and it's very satisfying also for the physician. So I really think it's a very good and interesting job.
Okay. And what about the minimally invasive or ablations versus traditional surgeries? What benefits do you think is for doctors and patients alike?
For doctors, for physicians, and for the whole healthcare system, this is very useful because we can spare money, because it's cheaper than a surgery, and we can allow, for example, more time for surgeries. So my surgeon is very happy of sending me patients for ablation when there's the indication, because they can use their time in the OR for doing other surgeries, major surgeries, and so overall there's a very good benefit for the whole community and for the entire hospital. So there's not only for the patient but also for physicians and hospitals that this kind of minimally invasive treatments bring a lot of advantage.